Hello, and welcome to Public Health Impact, PHI. I'm Phaedra Corso.
And I'm Cham Dallas. Today we're going to talk about the ongoing efforts in the state of Georgia to deal with one of the most important healthcare challenges in the state, and that's obesity, in particular, childhood obesity.
Cham, we rank 30th in the country in terms of our obese rate, and that's according to the United Health Foundation America's Health Rankings from 2013.
And in the last 15 years, the obesity rate in this state has almost doubled to 30%.
And you know, Cham, it's not just obesity alone. Obesity is associated with cardiovascular disease and hypertension and diabetes.
Well, for instance, diabetes, the rate has doubled alongside the increase in obesity, a doubling to 10% in diabetes. Same thing with hypertension. As the obesity has gone up, doubling, the hypertension rate has also gone up, where it's now almost 30%.
And so there are lots of good treatments, as we know, for diabetes and hypertension, but where public health really plays a role is in prevention, and that's the kids.
Yeah, Georgia was once the second highest rate of childhood obesity in this country.
But there's good news on the horizon, because the recent government statistics have shown that the childhood obesity rate in Georgia has dropped 5%, so we're now at 17th in the country.
Well, that's good news, Phaedra. And to continue this discussion, Phaedra is going to talk to the Dean of the College of Public Health, Dr. Phil Williams.
Dean Williams, can you give me an overview of how the College of Public Health is combating obesity in the state of Georgia, particularly around childhood obesity?
We really have it fully integrated into all the major aspects of the college: research, teaching, and service. Within the research area, there are a number of grants that faculty have, working in school systems and also working in the workplace to try to address obesity prevention and controlling obesity within those locations. Within the teaching area, we're in the process of hiring 2 new faculty that will be dedicated to teaching courses related to obesity prevention and also in performing research in that area. And then within the service arena, a number of our faculty are involved with the Obesity Initiative here at the University of Georgia, as well as we have students working in various communities where communities have identified obesity as an area that they need to work on, and those include places like Habersham County in northeast Georgia and Sumter County down in south central Georgia.
And tell us about your own involvement with the issue.
I've been appointed by the governor to serve on the Governor's Council for Childhood Obesity, which is a group of leaders from throughout the state, from industry, academia, and nonprofit organizations. And the governor has asked us through this council to advise him on obesity for state policy in the area, and also to help him promote the SHAPE initiative, which is administered by the Department of Public Health and is the initiative where the department works with schools to increase physical activity as well as help them live healthier lifestyles so that they prevent obesity.
I'm wondering who else is on this advisory panel?
It's a wide range of people. It includes people from the restaurant industry, from the food processing industry. It includes some general industry types, such as Georgia Power. It includes a number of representatives from nonprofit organizations. It includes people from healthcare. Kaiser healthcare system has the person from their organization actually chairs the committee. It includes a person from Georgia Public Television, so it's a wide range of people.
And so, I know you can't speak for the governor, but why such a broad range of people and expertise?
Well, it's such an important issue to the state. We have historically done very poorly in this area. It's an indicator of other health outcomes. If people suffer from obesity, they have many other health problems. It's very expensive for healthcare to provide health care to these people. That's an important issue for the state. It's also a very important issue in terms of economic development. In attracting new industries to come to the state or for existing industries to expand, they need a healthy workforce. They need a location that healthcare costs are low, and industry is using obesity as a surrogate for all these endpoints. And so if an area has a high rate of obesity, they're much less likely to either expand a plant or to locate a new plant to a given area because of the healthcare costs and the fact that the workforce may not be able to deliver the services that they need for their particular industry.
Thank you, Dean Williams, for such a great perspective, not just from the College of Public Health, but a statewide perspective as well. I'm now being joined by Dr. Marsha Davis, who's doing obesity research here at University of Georgia. Marsha, why don't you tell us why childhood obesity is an important topic for the state?
Childhood obesity is important for us to address because we are seeing adult diseases now in children. So when you hear of type 2 diabetes, high cholesterol, hypertension, we think of those being in adults. But now we're seeing those as early as first, second grade in our children. And that's going to take a toll on their bodies, that they're going to age much faster, be less productive in school, in work, and their quality of life will suffer.
So what kind of research are you doing to address this topic of childhood obesity?
We have a fun project that's being implemented in Colquitt County with elementary school children and their families. We are using the child as change agent as a way of changing both the home and the school environment.
So how easy is it for a child to influence their home environment?
Well, as we know, there's this fun dynamic between parents and children of food marketers have known that for a long time, that if they market to children, then children are more likely to ask for the things that they see and want. So we are working with that dynamic to have the kids ask the parents for more healthier foods and to be active.
So Marsha, what are some of the activities that we can do with kids to deal with this obesity problem?
I think it's important to think about the environment in which a child lives in. A child really in the younger years are really a function more of the environment they're in rather than individual choices. In younger kids, we think about daycares and homes as they move up, or schools and homes until they get to be in middle school and high school and are making their own choices. So my research is focused on changing the home environment so that the family can provide opportunities for healthy eating and physical activity. And I know folks at the Department of Public Health are focused on making the schools healthier places for more nutritious food and for physical activity opportunities.
So tell me about some of the activities that you're doing.
We are working with the children on messages of why it's important to eat healthy, giving them skills for them to work with their parents.
So give me an example of a skill.
They are tracking their eating. So for 1 week, it's looking at their fruit and vegetable intake and having those for snacks and meals instead of high-caloric, high-fat foods.
So that's on the nutrition side. Are you doing anything around physical activity?
Yes, we are giving both them and their parents a pedometer. We're giving them so they can track their walking. We're also giving them things that they could do at home with their parents, just a set of 4 cones that they could do running and tapping the cones and running back so that they can engage with their parents around physical activity.
And who are you funded by to do this research?
We are funded by USDA.
And have you found any surprising results yet? Or I don't know how far in your project you are.
We've just begun to implement the program. We'll be in 3rd, 4th, and 5th grades.
Great. And what else are you doing in the state?
We are also working with communities who are interested in starting programming and policy changes. For example, in Habersham County, they're interested in increasing walkability and bikeability in their community.
Okay, you have to explain that to me.
Well, walkability, say you wanted to go from your home to the grocery store to walk. But if a sidewalk ends or there's dangerous traffic, we're working with the community of how to have safe walking routes to grocery stores, to restaurants, to schools.
And the bikeability, I guess, is the same?
The same thing, only with a bike.
So thank you, Marsha, for telling us about the research you're doing. Next, we're going to learn about a statewide initiative to prevent childhood obesity. I'd like to now introduce you to Emily Vall, who's with the Department of Public Health. Emily, why don't you tell us a little bit about the SHAPE initiative and the history behind it?
Georgia SHAPE is Governor Nathan Deal's childhood obesity initiative. And the history behind it is basically it started as a bill that stated that every child in physical education, public school, K through 12, would be assessed via FitnessGram. It's basically a standardized fitness assessment. It's recently been adopted as the national standard, so we're very excited about that. And actually, we were also recognized as the first state to comply with the president's youth fitness program. So we're happy about that. But the actual assessment's comprised of 5 parts. It's a measure of body mass index, an aerobic capacity measure, a muscular endurance measure, muscular strength, and flexibility.
And does the state standardize what each of those components are, or do schools have the leeway to assess those any way they want?
There are choices for sometimes there's only one. Obviously, BMI, it's height and weight ratio, so there's no leeway in that one. But there are in others. So, for example, with aerobic capacity, if you're assessing a student that is on the younger side, then you can do the PACER test, which is a timed test that you can do in a gymnasium. Or you could do the mile run. And of course, everything's standardized, so the measurements and the scores are all standardized.
And so this was a law that was passed in Georgia?
Exactly. We've now collected 2 full years of data, and we're very excited about that. We've seen some progress. And from when that bill was passed and today, Georgia Shape kind of grew, and now we have all kinds of arms and legs going in all different directions all around childhood obesity.
So tell me a little bit about the data you've been collecting, and you said you've seen some progress. So what are you finding in those data?
So the one we look at 2 pieces very closely, aerobic capacity and body mass index. The first year that we had data was 2012, and we found that 43% of Georgia's children were outside the healthy range for body mass index. So that doesn't differentiate between being overweight and underweight, but obviously most were in that overweight and obese category. There are very few that were in the underweight category. The second year, that went down to 41%. So 2012-2013 school year, we dropped 2 percentage points, which we're very excited about. We were also really excited because we went from testing 97% of the state's school children enrolled in PE to 99%.
And so what happens if a child does the FitnessGram and finds out that they're obese or overweight? Like, what kind of information is provided to the child or to the parents? Like, what's the process?
Well, that is a really good question, and one that I'm very proud of. The Department of Education is one of our very strong partners, and they've been instrumental in getting all of this work done. And when we started collecting data around FitnessGram, the Department of Public Health, Department of Education, one of our partners, Health Empowers, all of the big players worked very, very hard to both pilot how we were going to do it, as well as train every single physical educator and some school nurses and regular ed teachers across the state to assess children in a way that both made sense and was very comfortable for the child. So for example, with BMI, weight is not something that anybody wants to do in public. If you asked me to get on a scale here on the news, I would say absolutely not. So with that piece, every teacher was trained to not only not allow the students to see what the numbers were, so there wasn't any room for chatter or talk or making fun of each other, but they also turned the child around on the scale so they couldn't see the scale and they do not actually get their information. The Cooper Institute helps any state that starts assessing via FitnessGram script communications. And then again, we worked with all the partners to develop communications that could be sent home to the parents. And they're aware that the child is being assessed at the beginning of the school year. So there's no surprises, and it's not done in a way that is hurtful or uncomfortable.
Other than the FitnessGram, what are some of the other activities that are part of the SHAPE initiative?
Well, the one that we're really trying to push right now is called Power Up for 30. That was kind of our answer to the aerobic capacity data that we collected. We really want to get students moving more in easy ways so they can, get moving at a young age and enjoy it throughout their lives and hopefully continue as adults. So Power Up for 30 is modeled after a school in Cobb County, Soap Creek Elementary School, and they basically took different pieces of time during the school day that was not being wasted but could be more active. So for example, when they were in the gym waiting for announcements, they would sit and be seated and kind of like a holding area for children. So now they've made it part of their culture to do Zumba every morning. So the older kids teach the younger kids, and they're all moving and active for 20 minutes every day before school starts. Power Up for 30 allows the state to train 3 educators. So ideally, it's a physical educator, an administrator, and a regular ed teacher to develop different pieces of physical activity that work well and fit their needs. And it's just very exciting because we've had all kinds of really informative brains help develop the program.
Well, it sounds great. What kind of resources are available to schools to start doing Power Up for 30?
So we have all kinds of partners that have partnered for this initiative. So when a school signs up for Power Up for 30, they take the pledge, they take a baseline survey, and this is only elementary school. I didn't make that very clear at the beginning. And in this survey, it addresses their needs, wants, what they do have, what they don't have. So once they do that, they go to the training with the 3 different people from that school. And one of our partners, Health Empowers, helps them identify what policy changes, what resources, what ways they can fit physical activity into their school. We have partners such as Hop Sports, which does brain breaks. So a classroom teacher can click on a link on the computer and get the whole class moving for 5 or 10 minutes during class lessons. We're partnering with Playworks, who is an excellent, they kind of instill anti-bullying curriculum to recess play. So they get kids moving more at recess and also teach anti-bullying components. And then we have all kinds of free and low-cost resources at their fingertips.
Well, it sounds great. How many schools are engaged in the Power Up for 30 so far?
So far, we're right at about 250.
250, are we talking elementary schools? Out of how many? Just curious.
1,276, 1,276 schools across Georgia. So we're on our way. We're excited. We're funded for 3 years. And the other nice piece of the program is not only do we do the initial training, but we also provide technical assistance. So if they hit barriers, they're able to overcome those with our help.
Thank you very much, Emily. It's wonderful to see what you all are doing here in the state. For those of you who are interested in Power Up for 30, we're going to see a short promo from Dr. Brenda Fitzgerald, who is our State Health Commissioner, and we'll also show you some of the exciting things that we're doing here on campus to prevent obesity.
We're at Soap Creek Elementary School in Marietta, Georgia. They have been pioneers in the Power Up for 30 movement. And basically the movement is throughout the day. It's not increased physical education time so much as increased physical activity. Before school, during school, and after school. It may be basketball, it may be a Zumba class, but the importance is movement. When we started looking at the issue, we need to make real change in Georgia. And to make real change in Georgia, you don't have to have a monumental program, but you do have to have consistency. You do have to have a daily program. And that's what Power Up for 30 is. It's 30 minutes every day, every school, every child in Georgia.
The latest research says that cardiovascularly fit kids are going to perform better in the classroom. Teachers, as a result of the research we've done around here, understand that if these kids can come in the morning and get their cardio on, they're going to perform better in the classroom. And the increases are significant in math, science, and reading, mostly to math. The programs here are optional for our teachers. Those who send their kids have been sold on the research. We're seeing the results. And if you want to do it and get in the game, I strongly encourage you to do that.
We have one of the smallest gyms in the county, but we are one of the largest schools in the county. So we had to get creative with how we offered our children more time for movement. Power Up for 30 will work in a school if you have the administration supporting it, your PE teachers, but also your classroom teachers. It takes the whole village. We have great feedback from our parents, but the bigger payoff is what we see from the students. They're more enthusiastic, their attendance has improved, discipline issues have decreased, and the big benefit, our test scores have improved as well.
You can bring Power Up for 30 to your school. It's easy. Go to georgiashape.org and take the pledge. Start tomorrow. Actually, start today.
And switch, bring it in. Seesaw. To the right. Switch. Switch the hands, step out left. Carry it to the left. Tai Chi is an ancient Chinese calisthenic that has been developed over thousands of years, first starting with what's called Qigong, which is a form of Chinese yoga, and then developed into Tai Chi when it combined both martial arts and Chinese medicine practices about 700 to 800 years ago. It is now used for range of exercise benefits, considered an aerobic exercise, a light aerobic exercise, and has been found to have a lot of health benefits. Tai Chi is for all age groups. Mostly in the United States, it's been marketed towards an older population because of its enhanced health benefits to help with range of motion, helps a lot with joint health, as well as flexibility. And they've also been noticing in research that it's helping to reduce the risk of falling for the elderly. It also has benefits that can help anybody. So by reducing stress, lowering blood pressure, increasing or lowering the inflammation and increasing our ability to take in oxygen. And so for middle age, it's helping a lot to get back that sort of youthfulness that they felt when they were younger. For the younger population, Tai Chi actually was rooted in martial arts. So for young people who are interested in expanding in their area of expertise in martial arts, the Tai Chi serves as sort of an advanced practice to help balance the hard style. So considered a soft style, it's able to use muscles and part of the body that the hard style sort of neglects. So if you think of it as taking incremental steps very slowly, by moving slow, you're able to work finer muscles that then generate greater power when you do move fast in a martial art application.
This is National Public Health Week, and we really want to show the public how we can improve our health. And I believe Tai Chi is one of the best activities, and I like it. So I want to demonstrate Tai Chi to people in this community. This is a joint project between Kaiser Permanente and our College of Public Health. And Kaiser Permanente really want to improve the health of our community, and our college responded. So now we have such nice Tai Chi performance, and I am one of the students. Of course, invite all people like faculty members, staff members, but also all people in the community, young and old, everybody is welcome. We offer this class on this Health Sciences Campus, and when the weather is really cold, we practice in the room inside the building, but when the weather is good, we practice like this. It's wonderful.
As we conclude our discussion on obesity research here at the University of Georgia, I want to talk to you, Phaedra, about the work that your group is doing here at the College of Public Health.
Thanks for asking, Cham. My group is called the Economic Evaluation Research Group, and we have a number of researchers on our team who are charged with looking at how much are states and schools really spending on the fitnessgram, on the SHAPE initiative, on Power Up for 30, adding 30 minutes of extra physical activity into their curriculum. And we're looking at the personnel expenditures, the space requirements, training, all of the resources required.
Well, why do we want to know that? I mean, why is it that the costs of doing these programs, why is that important?
Well, we hope that these interventions will, in the long term, show improvements in health outcomes for kids, reductions in obesity rates, reductions in future cardiovascular disease, for example. So if we know how much the state and the schools are spending now, and we have a positive health outcomes in the future, then we can hopefully show we have a positive returns on our investment in prevention.
Well, prevention is always better than having to treat later. That's a number one facet of public health, and particularly so with this problem of obesity.
So thank you for joining us in this episode. We'll see you next time on PHI Public Health Impact.